You are watching the Doctalk show.
Some of the most common STDs in our communities include syphilis, gonorrhea, and chlamydia. And these infections, what is underlying them, what the similarity is between them, is the fact that they are sexually transmitted. So obviously, having multiple sexual partners might increase the risk of getting these infections. However, we want to understand what would happen if, for example, you get an STD and you do nothing about it. Does it cause any complications in the long run? So maybe Dr. Chigundu, should people take these STDs quite seriously, especially in the ladies who the infection may not be as, let's say, as aggressive as in the men, may not cause the pain? What would happen if it's left untreated?
Yeah, certainly STDs should be taken seriously because most of the organisms that cause STDs, apart from Candida. Candida is not an STD, but yes. The reason I keep talking about Candida is because the public out there fears Candida more than anything else.
They fear Candida more.
Yes, it's not an STD. It's actually a little innocent, apart from causing a bit of discomfort and itching, but it is not as bad as these others. Okay. Yes, we should take STD seriously. In men, most of these infections will harbor into those organs that form semen, like the prostate and the seminal vesicles. They get comfort in those organs, and they can actually act as reservoirs, so that the disease becomes chronic. They actually are more like transmitters. Okay. Yes, so that is a big problem. It is very difficult to eradicate gonorrhea, for example, from the prostate, or even those glands called the seminal vesicles that form semen.
And these are in men.
Yes, and
so the men would be like reservoirs of some
exactly.
kind, passing the infection on.
Yes, and the infection can go deep down into the tubes that bring sperms from the testes. Call it the vas deferens, and cause obstruction there, and these men will present with infertility after some time.
Okay. Most of these effects are replicated in women, and these infections, when they ascend, when they go up the tract, they go on eroding, they go on infecting these organs. So from the uterus, you can get scars with a condition we call synechia. You can get scars, and then the uterus closes off, but that is not as common as in the tubes. Our biggest worry is when these infections ascend. They can cause blockage.
The blocked tubes.
In the tubes.
Okay.
Yes, actually, most women will present with pain because of these scars in the abdomen, and of course failure to conceive. And sometimes these infections are even contained, so the tube swells. Sometimes it swells with water. You just see water. It's called hydrosalpinx, or it swells with pus.
Is this the same as what sometimes in ultrasound women find things they call cysts? Are they the same? Is it the STDs which cause cysts?
Well, it's kind of different.
They're a bit different.
Yeah, they're different because the ovaries kind of not very.
Those are in the ovaries.
Yes,
but these are mainly.
Although they can also affect the ovaries, actually.
They can reach the ovaries.
Yes, these infections can reach the ovaries. Okay. Yes, so women may present with, apart from pain, they can have fevers, and this pain can be chronic, fevers, and failure to conceive, or nausea and vomiting. So because the infections can be overwhelming.
Very severe infections.
Exactly, and they cause nausea. And actually, these infections can go as high as up to the liver.
Okay,
they can affect, yes.
Spread now into the body.
Exactly.
Okay, so basically STDs are quite an aggressive infection.
The truth is you'll be lucky. You'll be lucky if you catch the infection at that stage.
When it is still
early. But the truth is most women we encounter in our practice have now got what we call PID. Someone once had the infection, it created havoc, it got cured, maybe they used antibiotics quite late, the infection got cured, but the infection left scars. The infection leaves scars which will trap the organs in the pelvis. You find the tubes caught up in the scars, the uterus caught up in the scars, and these
intestines also.
And these continue to cause chronic pelvic pain. So most of these women keep going to the gynecologists with chronic pelvic pain. People keep giving them antibiotics which are not useful. Yet the actual problem is scars. Yes, so we need to diagnose chronic pelvic pain or PID and treat it appropriately than giving women antibiotics after antibiotic. Then you cause more problems, vaginal discharges. So this is the whole sequelae of these.
Of an untreated STD.
Yes.
Are these infections treatable and can they be prevented?
Yes. Well said.
The STDs we're talking about, are all of them treatable? Or some are basically, once you have it, that's it?
So most of these infections can be easily treatable. But the unfortunate bit is most of our patients come late. They come late. Sometimes they see the signs and symptoms, but they try herbalists, they try herbs, they try
eating garlic.
Exactly, they try eating garlic. Some people steam.
And inserting garlic in the private parts.
Exactly.
Does that work, by the way?
No, of course not.
No, of course not.
They don't,
These people just try remedies they have heard about, but there's no science.
But they're just delaying the infection.
So most of them, if caught early, they can be treated. But well said, these infections, we have to first diagnose them. And for example, pelvic inflammatory disease or genital infections, we easily take off a swab, high vaginal swab, take to the lab, do culture and sensitivity. Then the results come back when they're clear. These organisms isolated, drug that treats the.
So those are the lab. But
exactly.
But basically, they can be treated. So what you're saying is, anyone who has an STD, any sort of abnormal discharge or abnormal wounds, go to the doctor ASAP.
Exactly.
All right. And as we conclude now, then the prevention, Dr. Chigundu, what can we do to prevent or protect ourselves from these STDs?
Being sexually transmitted, the first thing is to avoid acquiring the infections through sexual intercourse. So you either stick with one partner, or if you can't, then you have to use barrier methods, like condoms. But essentially, most of the STDs are carried sexually. And then there are those STDs that men don't seem to fear or don't know about, especially the human papillomavirus, the one that causes cancer of the cervix and cancer of the vagina. It is actually almost now number one. Yes, cancer of the vagina, sometimes, rather cancer of the cervix, sometimes I joke that it's an STD.
Could it be an STD?
In a way,
it's a disease because it's caused by something else sexually.
But the virus,
actually, more than 99% of women who have cancer of the cervix acquired it through a virus called human papillomavirus.
Okay. So that makes it almost an STD.
And in men, it can cause cancer of the penis or cancer of
later on.
The throat or
exactly.
Yes, the unfortunate bit is that men transmit it more to the women, and do rarely get those complications, but they can if it's not eradicated. That's why things like circumcision are very important. Maybe lastly, telling women that every time you have a vaginal discharge, please visit a gynecologist, because most of these vaginal discharges are as simple as putting a speculum, examining properly, seeing the nature of discharge and treating it, other than going to the pharmacy to buy antibiotics.
So
antibiotics are not friendly to a woman.
They will increase the candida.
They are not friendly to the vaginal tract.
All right.
Yes.
Untreated STDs equals complications such as infertility. So
you are watching the Doctalk show.
A typical pregnancy lasts 9 months. So if a baby is born before the 9 months are due, that baby is called a premature baby. So we're going to listen to our experts from Kawempe Hospital to tell us more about why mothers are delivering premature babies.
So many babies here. Ever wondered how they're told apart? A newborn baby's cry is a sign of good news for the most part. And at the neonatal intensive care unit of the Kawempe National Referral Hospital, this kind of good news is a daily occurrence. And unfortunate statistics, like that of 26 neonatal deaths per 1,000 births among poor Ugandans, are being dealt a big blow. As Loy Nabiri explains.
This unit on a daily basis has between 80 to 120 newborn babies. The daily admissions in the unit range between 15 to 25 per day. We receive neonates from within Kawempe Hospital, where we are right now, but we also receive referrals from other units and hospitals.
World over, what causes babies to get admitted to special care units? There are three main problems. The first one is prematurity, babies who come out before their due term. Then the second category are babies who have infection. Then the third category are babies who have birth asphyxia. Like the mother, if she has a chronic illness, she's a sickler, she has a kidney problem, she has a heart problem, or she gets high pressure during pregnancy, she may not be able to carry this baby. Either the baby will come out early on her own, or the doctors decide to take out the baby early because the mother's life is at risk.
For example, this section has newborns that are preterm or premature. The ideal weight for a normal baby is supposed to be 2.5. But Nakate was born at 1 kilogram. Because they are premature, their lungs are not mature, they cannot breathe well. We connect them to oxygen. This is an incubator. They need warmth. So when it is turned off, it keeps them at a temperature in that they cannot become cold, or what we call hypothermia. Wherever you see blue is a phototherapy machine, which is treating the jaundice in these preterm babies. They are also at risk of infections. So we start them on antibiotics. In the first few days, we give them what we call IV fluids, and mainly dextrose, a low strength of dextrose that we call 10% dextrose.
And when you are giving treatment, you check for the real name of the baby on the file. Then you check from the name tag, where they put for all the babies here, the name tag. So you confirm if it is the right file for the baby. This is the glucose. It is given actually 2 hourly.
And when they are stable, we allow their mothers to give the breast milk because they are still young. Even their muscles of the mouth cannot be able to suck on the breast.
We talk about the 3 delays in life. There's a delay at home when the parents are taking a decision to come to hospital. Then there's another delay which can occur on the way as the mothers come to hospital. Then there's a third delay that can occur in hospital. Those delays can cause birth asphyxia.
We give them IV fluids because they are not able to feed at that time. We give them also antibiotics because they are at risk of infections, but also many times they develop infections during the process of delivery or even handling after delivery. Babies who are asphyxiated or distressed develop convulsions many times, so we manage them also with anticonvulsants. And when they have improved, like the one who is currently crying and playing, it means they are active. We move them to another section of the unit to complete their treatment before we discharge them. And when we have discharged them, especially the preterms and the babies who have had birth asphyxia, we follow them up in a clinic that runs every Tuesday and Friday because their brains might be affected. They still get problems even when we discharge them. We usually don't discharge them when they are 2.5 kilograms. We discharge them before then, but as long as they are stable and the mothers are able to take care of them while at home.
Natandika okunywera eddagala wano e Kawempe, saayisibwa bubi era natuukawo ne bandabira bulungi era nga bakuwa ebbanga bakuwa buli mwezi ogenda ewaka n'okomawo n'onywa n'ogenda n'okomawo n'onywa. Baweza emyezi 7 olubuto ne lunyuma nga ndi waka ne nkomawo ne bankebera ne baŋŋamba nnina balongo.
Nali sina buzibu n'okujjako nali mpulira nnyo kamunguluzi. Lunaku nga 3 ne lutandika okunnuma. Nendooza nti oba lunumako nga bulijjo nengenda mu ddwaliro.
Nali njawo alhamdulillah nga ziweze nga weeks 2. Olubuto ne lunnumira ddala. Ne bampitira dokita n'ankebera n'aŋŋamba ogenda sobola okukola ki okuzaala.
Bwe natuukayo ne baŋŋamba omwana atuuse ofufuma.
Nabazaala nga babulako. Ne babantwalira mu special care ne babeerayokko kumala nga weeks 2. Ayasooka okufuluma namuzaala alina kilo 2, owookubiri ne muzaala ng'alina kilo 1. Waliwo enjawulo kuba baabaleeta nga tebali bulungi kiri awo nga banafu, naye kati olabawo enjawulo, omwana ayonka yeeyagala ate bakuwa tayimu gy'olina omuyonsezaamu, babalabirira na bulungi.
Mu ddwaliro baatugamba obeere ng'olya ku greens, olye ku bibala n'okufunako obudde n'owummulamuko.
Abasawo baayogeranga bulungi nnyo nga batusomesa olunaku ati first lw'osooseeko lwe bakusomesaako by'olina okulya, obuyonjo bwe bityo balina okusomesa engeri gy'olina okulabiramu obulamu bwo ggwe n'omwana wo.
Nkubiriza abakyala mwenna abali eno, bw'oba nga muli embuto mwangu okubeera nga mugenda mu ddwaliro mufune antinento n'obujjanjabi obulala oba muli balwadde.
I wish our mothers could know to attend antenatal clinic early and also to honor the 4 scheduled visits, because when they come to hospital, then the doctors are able to capture some of these problems.
Please send in your comments or questions on our social media handles on Facebook, on Twitter. We want to answer each and every question you have regarding STDs or regarding Candida or any of the infections you've had on the discussion. We'll see you next time on the Doctalk show. Goodbye.